Community Nurse Presentation, Parish Nurse by Rob Williams, RN. Parish nursing is a specialty practice recognized by the American Nurses Association. Parish nursing, also called faith community nursing, combines professional nursing with health ministry, emphasizing health and healing in a faith community. What started with 6 congregations in 1984 now includes more than 10,000 parish nurses, both in the United States and internationally. Parish nursing embraces the spiritual dimension of the nursing practice in addition to the physical, psychological, and social dimensions. In essence, parish nurses care for the body, mind, and spirit. Parish nurses collaborate with their faith community leaders to form partnerships with other community health resources. Parish nursing services are designed to involve individuals, families, and congregations as active partners in their personal health. Through this involvement, nurses help empower communities and foster an environment of understanding and support. Some of the primary activities of a parish nurse are as follows. Integrator of faith and health, where the parish nurse serves as a translator between faith and healthcare communities. With a knowledge base in both areas, many times the parish nurse can clarify issues or reinforce strong ties between faith and health. Health educator. Parish nurses provide educational programs to the congregation, such as health screenings and illness prevention. Advocate. The parish nurse assists congregation members in finding their way through the tangled maze of today's healthcare system. Referral agent. Parish nurse finds resources and makes referrals to agencies, organizations, and support services to improve the members' quality of life. Developer of support groups. Parish nurses initiate and organize groups designed to assist the participants with specific issues. Trainer of volunteers. Recruiting and training volunteers is an important aspect of parish nursing. These volunteers are to provide support with the activities conducted by the parish nurse. The scope of practice of a parish nurse is the specialized practice of a faith community nursing that focuses on intentional spiritual care as an integral part of the process of promoting holistic health and preventing or minimizing illness in the faith community. Parish nurses function within the Nurse Practice Act of their jurisdiction. If dependent functions are practiced, parish nurses must be in compliance with the legal criteria of the Jurisdiction Nurse Practice Act. If allowed by the Nurse Practice Act, advanced practice parish nurses have the ability to prescribe. Parish nurses do not provide hands-on care or perform invasive procedures as in the traditional nurse setting. Instead, they would act as liaison between the parish members and clinical healthcare members. Some of the teaching and learning strategies that a parish nurse might use are collaboration and cooperation. With collaborative and cooperative learning, instructional approaches are used in which students work together in small groups to accomplish a common learning goal. They need to be carefully planned and executed, but they don't require permanently formed groups. A critical thinking strategy is a collection of mental activities that include the ability to intuit, clarify, reflect, connect, infer, and judge. It brings these activities together and enables the student to question what knowledge exists. Prayer allows the parish nurse to bring together and clarify the bond between faith and health. Humor can enhance student learning by improving understanding and retention. Learner-centered teaching means the student is at the center of learning. The student assumes responsibility for learning, while the instructor or parish nurse is responsible for facilitating the learning. Thus, the power in the classroom shifts to the student. Mobile learning is any type of learning that happens when the learner is not at a fixed location. Social networking tools allow the parish nurse to engage parishioners in new and different means of communication. And in our world today, social networking tools are becoming more and more common. While there is currently no certification for the specialty of parish nurse, there are some educational requirements. You must have an active license in the state in which you practice. You should have a baccalaureate degree in nursing with experience in community nursing. You should have completed an educational course to prepare for your ministry. You should have specialized knowledge of the spiritual beliefs and practices of the faith community in which you will work. You should reflect personal spirituality maturity in your practice. And you should be organized, flexible, self-started, and a good communicator. A lot of parish nurses work on their own and definitely need to be well organized and self-starters. Disciplines or professionals that the parish nurse interacts with? Well, parish nurses work closely with professional healthcare members, faith community pastoral care staff, and lay volunteers who represent various aspects of the life of the congregational community. Some of the necessary skills and abilities required to be a parish nurse are the ability to understand the nursing scope and standards of practice, being a good communicator and motivator, having superb supervisory and organizational skills, being knowledgeable in conducting physical assessments, knowing how to follow the nursing process thoroughly, being familiar with community resources, being up to date with the latest developments related to nursing and health, being willing to work with religious-based communities or groups, and being able to respect and share the faith of the group in which you are working with. What I found unique about the role of the parish nurse was that in the beginning, most of the parish nurses were Protestant. Now, the Protestant majority is still there, but there are faith community nurses in many religions, including Muslims, Jews, and Hindus. Also, while parish nursing was largely based in the United States, it is now in more than 23 countries around the world, including Australia, Korea, Malaysia, South Africa, New Zealand, Mexico, and Canada. I found this role to be very interesting, and I hope you learned something. Thank you for your attention.